Hi, my name is Lindsay. I am the North East and North Cumbria Health Champions Programme Manager, hosted by Vaughan. The National Core 20 Plus 5 Community Connector Programme uses the Health Champion model to link the NHS with grassroots voluntary sector organisations and communities, listening and investing in their expertise to help shape health services and messaging, ensuring the most marginalised communities are reached, having a direct effect on tackling healthcare inequalities in our region. The three inspirational people you're about to meet volunteer as health champions within Gateshead. They make a difference within their communities by making sure their collective voice is heard.
My name's Debbie Quinn. I work for HealthWorks.
Hello, my name is Louis. I am a volunteer at the Lawnmowers Independent Theatre Company.
My name is Robin Herdman. Sign name is Robin because of a red-breasted robin. This is part of BSL, British Sign Language. Of course, I am involved in the deaf community. My role is in relation to two things. I work as a BSL teacher from level 1 to level 6, and I'm also involved in translation of National Health Service information to make it more accessible for deaf people.
As part of my role, I can go into different organisations, different communities. I've been to the Comfrey project where they had translators and talking to people that have got different cultures.
I help with operational side of things, filmmaking and editing iMovies. I am also the MEC champion for the Lawnmowers Independent Theatre Company. I have autism, ADHD and verbal dyspraxia. The Lawnmowers is run by, for and with people with learning difficulties. 11 projects ran over 5 different art forms: singing, DJing, dance, drama and percussion. There's over 100 places a week with 30 active learning disabled artists going into communities on a regular basis.
As a cancer champion, I think it's great when you go and talk to somebody and they actually take in what you're saying. Well done. Yeah, that's what everybody should do. If they talk to somebody and it makes somebody do something to help them, it's well worth it.
So it's about promoting the deaf community and raising awareness. It's very important to get information on health issues. MEC have asked me to translate some of their documents from English into British Sign Language video so that deaf people have a quality to access the same as hearing people. And there is no inequality there. It's just so that they understand the information.
As part of HealthWorks, we also have gyms, and clients come in to go to the gym. And I used to be a receptionist, but now on the cancer team. So when I seen someone that I used to know, and I was asking how they were, and I told them I was on the team, they were said, "Hey, do you know what it is? Every time I go to the toilet," she says, "I'm going really regular, too much." He says, "But when I come to the gym, you've got posters on the back of the door that tell you to look out for prostate cancer." And I thought, after a few weeks, I thought, I'm going to go and do that. So he says, he went to the doctors. He says he was like so embarrassed. He says, but after reading their posters, I thought, no, I'm going to get checked out. He had an infection. He would have left it, but seeing those posters on the doors made him go and say they give him antibiotics, and he was fine. But he said, I would never have went. It's so embarrassing for a man to go and get checked over, but it was much better than what he thought it was going to be.
As a MEC champion, it's my job to go to the meetings with the public health team and to feedback that what information Lawnmowers has been doing that week, and the information that they give me, I feedback to the company. I mentioned one week about our amazing creative healthcare awareness training and to the MEC group, and the MEC representative from the QE hospital was on the meeting. So he was like, "Oh, that sounds interesting, I'll have that." So we had a job with the QE hospital to go and deliver our creative healthcare awareness training to 120 staff nurses over 2 days. And that was us making every contact count by making that connection.
Hearing people have that access through radio, newspapers, media, but deaf people miss those kinds of opportunities because that information needs to be visual through pictures and through sign language to make sure that the access is of the right level, to build that deaf person's confidence. And it's all about working together with different communities to be able to support and champion them.
If a member here was worried about a particular thing with COVID, I could go back to Louise from the public health team, give her that information, and then she could give me information back to help relieve that worry, so that when I went back to the group, they knew that guidance and information. You never know what you're going to get out of it. You might bring something to the table that they might need, or they might bring something to the table that you might need, or there might be a connection you didn't think you would be requiring, and it will help.
For me personally, I like meeting deaf people face to face, sharing information on health, providing information that they did not previously have, and access to what they have not heard before. And to see that interest in them, and for them being able to spread that word, creating more contacts, maybe creating more jobs for deaf people in the NHS in the future. I think that would be a lovely opportunity.
If you're thinking about it, do it, because if you've got the knowledge, you can pass that on, and it makes all the difference to the community. Because a lot of people don't like to talk about things, but how you face things and how you approach people, they will listen to what you have to say. It's well worth it.
Anyone can be a health champion. Being able to cascade information to others on a large or small scale, sharing a social media post or having a simple conversation with a friend, colleague or neighbour, it is all vital in tackling our region's healthcare inequalities. If you engage with others professionally or socially, work in the community or with an underrepresented or underserved group, run a community club or drive a community transport, work in a voluntary sector organisation or a face-to-face public service, then please get in touch. Help us shape the services your communities need to suit them.